Thank you. And then here's the agenda for today. So I'm Sarah Hodson. I'm the Executive Director with Get Healthy Utah, and we're excited to be hosting this meeting today and to have all of you here. Ellen Maxfield from the University of Utah is going to talk to us a little bit about type 2 diabetes, pre-diabetes, and the national DPP. So I know many of you are familiar with diabetes and with the national DPP. So she's going to give us a nice quick overview on that. And then we have Laura Summers from the Kem Gardner Policy Institute, and she's going to do a quick Medicaid 101, which I think you'll really appreciate. I know I appreciated learning more about Medicaid and just kind of the basics. And then we're really pleased to have Representative Suzanne Harrison here with us today. She's going to talk more about the bill, the legislation that happened last year, the proposed legislation for this year, and give us some tips from her perspective. So we appreciate her time. Laura Keller from the American Diabetes Association is going to talk more about how we tell our story, whether we're a person with diabetes or a lifestyle coach, or we're a person who works with people with diabetes. How do we help share our own personal story and experience with legislators? And then Carrie Butler from Upstream Consulting is going to give us some next steps on talking with legislators. We are near the end going to share a Google form asking you if you're willing to help us to put your name, email address, so we can contact you about setting up meetings with legislators or sending letters, making phone calls. So we'll put that in the chat in a little bit, and hopefully you're willing to participate with us in that way. So we'll start with Ellen. Okay, Ellen, go ahead and just tell me when to advance your slides.
Perfect, thank you. Well, thank you everyone for allowing me to speak with you today a little bit about diabetes, pre-diabetes, and the National Diabetes Prevention Program. This is a cause and an effort that is near and dear to my heart. I run the Diabetes Prevention Program at the University of Utah. I'm also a trained lifestyle coach and a master trainer select. So I do a lot of areas of diabetes prevention. I will say that right now I am here as a private citizen and not as a representative of my institution. So as Sarah said, a lot of individuals are familiar with diabetes and prediabetes. I'm just going to give a quick overview. Type 2 diabetes is raised blood glucose in the body, as the body cannot use its naturally produced insulin to regulate blood sugar. An example of that would be a fasting blood sugar of greater than 126. Versus prediabetes, which is blood glucose levels regularly higher than normal. So that's when your blood sugar is higher than normal, but not so high to be diagnosed with type 2. An example of that would be a fasting blood sugar over 100, but less than 126. Next slide. So some statistics that you might already be familiar with is 1 in 10 Americans have diabetes, and the vast majority of those individuals have type 2 diabetes, or 95%. A diagnosis of diabetes leads to 2.3 times more healthcare costs, and 25% of US healthcare dollars go to diabetes, including medications and hospitalizations. So approximately $245 billion is spent annually. In Utah alone, more than $1 billion each year is spent on direct and indirect costs of diabetes. Pre-diabetes, 1 in 3 adults has pre-diabetes, but 9 out of 10 don't know it. Prevention is cost-effective through the National Diabetes Prevention Program. So when we look at the statistics of how many people are impacted and the cost of the conditions, we really start to see that the prevention piece is really important. Next slide. Some risk factors for diabetes or having pre-diabetes. So if you've already been diagnosed with pre-diabetes, you're more disposed to develop type 2 diabetes. Being overweight, over 45 years or older, having a family history, so a brother, sister, or parent with type 2 diabetes, being physically active less than 3 times a week, having a history of gestational diabetes, which is diabetes during pregnancy or giving birth to a baby who weighed more than 9 pounds, having polycystic ovarian syndrome, or being African American, Hispanic, Latino, American Indian, Pacific Islander, and some Asian Americans are at higher risk. Next slide. So the big question is, why is type 2 diabetes so costly? Unfortunately, diabetes increases the chance of heart attack, stroke, blindness, kidney failure, loss of toes, feet, or legs. And as you can imagine, with each of those conditions, healthcare dollars have to be spent to treat and to prevent further injury or illness. Next slide. So the CMS, Centers for Medicare and Medicaid, did an evaluation looking at the cost of diabetes treatment. As you can see in the graphic, an increased cost of over $8,000 per individual who developed diabetes over a 3-year period. So that broke it down by year. In the first year, they spent almost $2,500 more. Year 2 was $3,100 more. And by year 3, they had spent $2,300 more than an individual who was not diagnosed with diabetes. When we contrast that to the cost of the National Diabetes Prevention Program with an annual average cost of about $500 per participant, you can see that you could take the diabetes prevention program almost 5 times for the cost of a single year after being diagnosed with diabetes and the cost of treatment. Next slide. As mentioned, the average medical costs for people diagnosed with type 2 diabetes are more than 2 times higher than those without type 2 diabetes. So this is looking at commercial insurance. Annual expenditures with diabetes in 2015 per person was $16,750. And an individual without diabetes cost about $7,282. So as you can see, the cost of treating diabetes far outweighs the cost of having to support the National Diabetes Prevention Program. Next slide. Again, this is just another view if you prefer graphs instead of charts. This shows at baseline, 2 individuals had similar healthcare expenditures, and the top dotted line is an individual with a diabetes diagnosis versus the bottom solid line with no diabetes diagnosis, years 1, 2, and 3. And you can see that those healthcare costs just continue to increase, where the healthcare cost of an individual without a diagnosis of diabetes stays relatively steady. Next slide. A lot of people have asked, why are we talking about diabetes right now? Everything is COVID-19. And I think the important thing is the pandemic really is a wake-up call for wellness. Knowing and working to mitigate risk in illness is really an opportunity. And the National Diabetes Prevention Program is something we can do. We can take action now to prevent any injury or illness down the road. Next slide. So many of you are probably familiar with what the National Diabetes Prevention Program is, but I'll give you a little bit of a background. It's groups of eligible participants meeting together for 1 year. The sessions are led by a trained lifestyle coach. Participants support each other. A big portion of the class is really about problem solving and learning from one another, working through issues. Sessions are going to focus on physical activity, nutrition, motivation, a number of topics that are going to all impact and influence health. Next slide. So how is the National Diabetes Prevention Program structured? So it's delivered through CDC recognized organizations. So in order to offer the DPP, you have to be trained, you follow a standardized curriculum that's been approved by the CDC. Currently, there are 22 organizations statewide offering the DPP. Sessions are weekly, 16 weekly sessions delivered months 1 through 6, and then it goes to monthly sessions 7 through 12. So it's a little more intense up front while you're trying to make some of those behavior changes and setting that lifestyle change. And then the participants get a little more leeway towards the end and then come back in monthly to check in and make sure that things are still on track. Program goals. The hope is to have a participant lose 5 to 7% of their starting body weight, increase their physical activity to at least 150 minutes per week. And now for the new 2021 DPRP standards, a 0.2% reduction in their A1C. The format is throughout the state, we have a variety of options: in person, online, so fully virtual asynchronous, or a live virtual option. Additionally, it's offered in many different languages. The multiple languages helps with minority populations or populations that might not have ability to get to a standard class. Next slide. The big question is, does it work, right? It sounds like we have a great option, but we want to know the statistics of does it work? The nice thing is people with prediabetes can cut their risk of developing type 2 diabetes by 58%. 58%, more than half have their risk. If you are over 60 years old and do complete the National Diabetes Prevention Program, your risk is cut by a whopping 71%. When we talk about long-term outcomes, at 10 years following the study cohort, 33% of the original participants still did not have type 2 diabetes. If a participant had developed type 2 diabetes, it was delayed on average for at least 4 years. So again, thinking about those costs, even developing it later saves dollars. Next slide. So what does the national DPP look like? It looks like your neighbors. It looks like your family members. It might look like you. It looks like people coming together to support one another to make a change. So far, we have had 5,368 individuals enroll in the National Diabetes Prevention Program in Utah. Let's try to make it more. Next slide. So cost and reimbursement. Obviously, this is trying to get funding, so it'd be a shame to not talk about costs. So the costs for the National Diabetes Prevention Program cover materials, the coach time, technical time, some incentives, and scales or food trackers if the organization opts to offer those. In terms of reimbursement, there's some payer coverage. Medicare already covers the National Diabetes Prevention Program, as well as a number of select commercial insurances throughout the state. So Select Health, EMI, University of Utah Health Plans, Aetna, Regents Blue Cross Blue Shield, United Healthcare. Many organizations are using it as an employee wellness benefit to encourage their employees to engage in wellness. There's some grants and foundations that are paying for it, and other individuals are just opting for self-pay. I think the important piece to this is wanting to get Medicaid added to this list. It can really help serve so many individuals and prevent diabetes from ever having to be an issue in a person's life. Next slide. Thank you.
Thank you, Ellen. I forgot to mention before, if you have questions, to put them in the chat, and Morgan's monitoring that. Any questions for Ellen, Morgan?
There's none that I'm seeing so far, but if questions come up, even if it was on Ellen's presentation, feel free to ask them and we'll come back and address them.
Great, thank you. Okay, Laura. So Laura Summers is from the Kempsey Gardner Policy Institute, and she's going to tell us a little bit more about Medicaid.
Great, thank you. Can you hear me okay? All right, well, my goal today is just to really provide a quick and brief introduction to Medicaid that will hopefully give you a starting place to better understand Medicaid in general, and more specifically Medicaid in Utah. So if we'll just jump to the next slide. To start, I'm going to cover just really quickly 3 things that I think, if you don't remember anything else, these are some important things to remember about Medicaid. First, it's important to know that we're talking about Medicaid and not Medicare. So Medicaid is America's public health care coverage program for low-income individuals, while Medicare is the public health care coverage program for individuals age 65 and older, and some persons with disabilities. Now, I say this not because I think this audience needs to know this, but just because how many people in the policy sphere get the 2 programs confused, particularly if you are working with policy leaders who don't deal with healthcare issues on a day-to-day basis. So it can be important to just really specify that you're talking about Medicaid and not Medicare. Second, Medicaid provides health insurance coverage to roughly 1 in 5 or 20% of the US population. If we'll just jump to the next slide, here you can really see how Medicaid enrollment has increased over time. And interestingly, it surpassed Medicare in terms of volume a few years ago, making it the largest public health insurance program in the US today. In Utah, latest enrollment numbers show there are about 415,000 people enrolled in Medicaid. And with such a large footprint, this really creates opportunity for increasing access to chronic disease prevention programs. If we'll jump to the next slide. Finally, it's critical to remember the old adage that if you've seen one Medicaid program, you've seen one Medicaid program. And it's important to know this because Medicaid program design varies significantly on a state-by-state basis, but also because there's a lot of flexibility in Medicaid program coverage and design, which provides opportunities to cover programs like the National Diabetes Prevention Program. As such, today we'll quickly cover 4 key fundamentals of Medicaid, including financing, benefits, eligibility, and program delivery, weaving in some Utah-specific details. So the first thing that is helpful to know is that Medicaid is financed through a federal-state partnership where the federal government matches Medicaid spending according to a formula set in federal law. So the Medicaid match varies on a state-by-state basis and is determined by state per capita income. And as you can see in this map, the rate really ranges from about 50% to 75%. Utah's match rate is about 67%, meaning the state is responsible for covering 33% of Medicaid costs and the federal government covers the remaining 67%. Or in other words, for every $1 spent on Medicaid, the federal government pays 67 cents and Utah pays 33 cents. We'll jump to the next slide. In terms of Medicaid benefits or covered services, there are a core set of federal mandatory benefits that must be offered by every state Medicaid program. The 15 mandatory benefits and services are listed here. However, I think the most interesting thing about this list is the services that are not listed. Prescription drugs, for example, are not actually a mandatory benefit, neither are dental services. That said, as I mentioned earlier, states do have flexibility to offer additional benefits, and most, if not all, states cover these types of services as well as many others. If you'll jump to the next slide, this map actually comes from the National Association of Chronic Disease Directors, their coverage toolkit. And what you can see from this map is that 17 states have actually moved towards adding coverage of the National Diabetes Prevention Program as an optional benefit, and several more states, like the state of Utah, hopefully, are in the process. Now, in terms of Medicaid eligibility, if we'll jump to the next slide. So Medicaid is primarily provided to low-income children's parents, pregnant women, seniors, and persons with disabilities. And these are the core group of individuals that make up Medicaid in every state. However, the Medicaid expansion provision in the Affordable Care Act increased Medicaid eligibility to a new population, which was low-income childless adults, by raising the mandatory eligibility level for other adult populations to 138% of the federal poverty level. And as many of you know, Utah did officially expand Medicaid in January 2020. If we'll jump to the next slide. So this is roughly what Medicaid coverage looked like before Utah expanded Medicaid. It's a little hard to see on this slide, but Utah had actually expanded its Medicaid program to several different categories of adults, offering different benefit packages and different services, different levels of services at different levels of eligibility. But underneath that blue line, you could still see that there were quite a few gaps in terms of the number of low-income adults that were eligible for Medicaid. And if we'll jump to the next slide, this is roughly what Utah eligibility looks like today, now that we have expanded Medicaid. So you can see that all of those gaps have been filled in, and now any individuals with income up to $18,000 per year, or if you're in a family of 4 with income up to $37,000 per year, are eligible for Medicaid in Utah. The last point I want to cover today is just delivery models, specifically managed care. So a lot of states, including Utah, use managed care. In Utah, they're called accountable care organizations, to manage the care and services delivered to Medicaid beneficiaries. In return, the state pays a fixed payment to ACOs for each person enrolled in the plan. And then the ACOs then develop networks of providers to provide services to their members. So getting to know these ACOs can be helpful when discussing chronic disease prevention programs, as they will play a key part in program delivery. So I know that was a quick and rapid snapshot, but hopefully it'll be helpful to your work, and just wanted to thank Sarah for the opportunity to present today. And at this point, I'll turn it back to her.
Thank you, Laura. That's really helpful, and I hope for those on at least gives you a little bit of a background on Medicaid. So when we're talking about the legislation, you feel a little bit more prepared with that understanding. Thank you. Now we're going to be able to hear from Representative Harrison. I'm going to actually stop sharing slides so we can see everybody who's on camera while we hear from her.
Thank you so much, Sarah. I really appreciate the opportunity to meet with everyone. And so many of you on this call were instrumental in as far as the legislation went in 2021. I was the sponsor of expanding coverage for the National Diabetes Prevention Program in the 2021 general session, this past session. And we actually had enormous success in each of the committees that we presented it in, and it was on the Senate board and moving strongly ahead. And then towards the end of the session, it just didn't receive the funding to be able to get passage. So I feel confident that with the great start we had this session and all of you being involved, I feel confident we can get it across the finish line this year. This issue matters to me personally, but also as a practicing medical doctor. Every one of you probably has loved ones or friends or family that have diabetes, and the impact that it has on so many lives is just, it touches every American. And as a medical doctor, and as many of the presenters already highlighted, this disease impacts so many aspects of a patient's life and quality of life. And I see it in addition to the risks of, heart disease, stroke, kidney issues, blindness. I also see it as an anesthesiologist day to day in the operating room in delayed wound healing and the difficulty that patients with severe diabetes have during a surgery and recovering from a surgery. So this disease has wide, devastating effects on patients. The other thing that I think we really need to be talking about more is the role that focusing on prevention of disease and early intervention in prevention and also early intervention in any disease process is the important role that will have in improving and controlling healthcare costs in the United States. As you are all well aware, we have some of the highest healthcare costs in the world. We too often are addressing an issue once it's become a serious problem or even a crisis. I believe strongly that the key to curbing and controlling our healthcare costs is in moving further upstream and focusing on prevention and early intervention. It's the fiscally conservative and fiscally responsible thing to do, but more importantly, it will dramatically improve health outcomes and help people take control of their own health and that the tools that people need to live their best life. So in terms of why we need you, each of you on this call, I think all too often, people don't realize the power that they have in influencing local policy until they're asked to participate. I think too often, what's going on in Washington, D.C. takes up everyone's energy and all the news headlines. But your ability to have an impact in Washington, D.C. is pretty small, but your ability as a resident to have an impact in local government is enormous. When we as legislators, I represent the Sandy Draper area in the Utah House, when we hear from constituents at that local level, you can have a powerful impact. And I encourage each of you to form relationships with your local school board, your local city council, but also don't forget your state house representative and your state senator. It's critical. And it's as simple as picking up the phone and calling and asking to meet with your state house rep or your state senator. Shooting them an email is very effective. And then always mention that you're a constituent and let them know that you care about the issues that matter to you. And I assume that all of you on this call care about how can we help our loved ones and people in the state of Utah have access to this important and very effective diabetes prevention program. So I hope that each of you will reach out to your state representative, your state senator, ask them to support this legislation. Tell them a little bit about why this matters to you personally, whether it's your clinical practice or your professional expertise or your personal story of a loved one that has suffered from type 2 diabetes, and why this type of program can help our neighbors and our friends, but also our fiscal, our state budget and state pocketbook. I think these things and your ability to reach out to your local elected officials will be critical to the success of this bill. Many of the other presenters have already highlighted on why this matters. 25% of Utah's healthcare dollars go to treating diabetes. And this program is one of the most well-studied, highly effective prevention programs in the world. And for us to expand the coverage for the National Diabetes Prevention Program will help our Medicaid population improve their own health, get the tools they need to take charge of their own health, and also help our state budget and reduce those costs. There's an ongoing concern at the state legislature about the exploding costs of healthcare, and certainly anytime we can prevent someone from developing a very expensive disease, it helps them, but it also helps state budgets. So I plan to run the legislation again this year. There will be a little bit of a tweak in that we're going to run it as just an ongoing program with a report after 3 years being sent back to the legislature with some measures of efficiencies, how well it's been working, how many folks have participated in the program, and hopefully that will give us a benchmark to show how effective it is. We have some new fiscal estimates from the Department of Health, and I think that it will help bring the fiscal note down. This bill comes with a significant state contribution, but it also importantly brings federal matching funds, which I think will help offset any costs to the state budget and really help those patients. We're targeting, there's about 17,000 Medicaid patients in Utah who we estimate have prediabetes, and the fiscal estimate that we're running the bill at is based on the experience of other states. About between 1% and 3% of eligible populations will want to opt into the year-long program each year. So that's how we get the fiscal estimate of what we're asking in the state budget. I hope each of you will reach out to your representatives and state senators, ask them to support this bill. And we want to keep you in the loop and keep you informed of how things are going. And I just can't tell you enough how much I appreciate each of you on this call, your support, and for working to help improve the health in our state and also do the fiscally responsible thing by covering these important prevention programs. Thank you so much, Sarah.
Thank you. I think for those of us who have been working on diabetes prevention for a number of years, and I know just from the names on this call, many of you for many, many years, it's just so exciting to have a champion like Representative Harrison and to hear that message from you, and how exciting that we can work together on this. I think our experience last year was a good one with the bill, and I think this is going to be even better. So thank you so much for your commitment to this and for the opportunity that we all have now to hopefully make a difference in the lives of people with Medicaid and with prediabetes and have an impact in the state. So thank you. Now we're going to be able to learn from two experts on how do we talk to legislators, how do we share our personal stories, kind of what are the next steps for each of us to get involved. We're going to put in the chat a Google form, a survey for you to fill out. If for some reason you aren't able to access Google, you can put your email in the chat and we'll send it out to you via email. This is just going to help us get a list of people who are willing to help reach out to legislators, set up meetings, make phone calls, and the information you're going to hear next from from Laura Keller and Carrie Butler is going to prepare you to do that. So if you're thinking, oh, I don't know how to do that, or that makes me intimidated, you're going to get some good skills in the next 20 to 30 minutes. So I'm going to have Laura go ahead and go next, and then we'll put that link in the chat for you to do at the same time.
Great. Hi, I'm Laura Keller. I'm with the American Diabetes Association. I'm your state director of government affairs. And first, it was a real pleasure to work with those of you that we work with and Representative Harrison last session. And we did great work. Sometimes things happen though. Budgets are tricky, especially as you're coming out of a pandemic. So I'm going to talk to you a little bit just about, it's kind of like thinking of it as talking to a friend, a relationship building and sharing your story. So we'll go to the next slide. So it's really easy. And when I say tell your personal diabetes story, it's as easy as 1, 2, 3, it really is. And it's your story, whether you have diabetes like someone like me, or you have a family member that you're sharing that story, or you're a healthcare provider or a lifestyle coach. Next. So lead with the personal. One, make it real. So you don't have to put a lot of facts or data, but make sure that you're painting a picture that they can understand, right? Use words, especially if you're putting something in writing, that elicit some sort of a mental image for them about what it's either like for patients or things like that. Keep your story local. So particularly when you're talking to a state legislator and you live in their district or you work in their district and you're talking to them about the impact of these programs in their district, make sure you tell them that. So make sure you let them know. If you're providing this program in their district, let them know where that is. Let them know that it's in their district, it's in such and such a town, or in this area of town, that kind of thing. So make sure they understand that. And then make sure you understand when you're talking about this, particularly because there is a cost associated to it. You want to talk about it with a hopefulness that like this program makes a difference. Just as Representative Harrison said, we can save Utah money by providing this program and keeping people from having diabetes. So make sure you also talk about that positive side of having access to this. And then keep it brief. So that's just not just in meetings, but it's also in your emails. So if you send too much information, it might get skimmed. And you want to make sure that you're providing just enough, but not too much. So try, you don't have to write like a 1-page paper like we all had to do in high school, right? On things for an email. And then the most important thing is, as you're developing a relationship with your legislator, or if the bill is coming up and you're writing to your member and asking them to support it, make sure you say, will you please vote for this bill? Or will you please support? And then we'll have the bill number. And the one thing I also want to make sure you are aware of is that when this starts to move, we're going to give you the exact bill number and the information and where it is in the process to make it super easy. So when we get to the time where you're making asks and asking for support, we'll make it very easy for you to engage and know exactly what you're talking about so you can be an expert at what stage that is. Next slide. So facts are important, but they don't have to be the leading thing. So in this case, we're going to be providing a lot of statistics. And if you're a healthcare provider and you have a program, or you're a lifestyle coach and you have a program and you have some data that you can talk about the success of your program, put in some of that and that's great. But often a stat sheet that you attach to your personal story, if you're emailing it or you're in a meeting, is just as effective. So you can highlight 1 or 2 things and then leave that as a leave behind. As a group, we will be compiling a lot of facts and data, and we will have been giving that to legislators and the committees and things. So you'll also have access to our fact sheets. But if you have personal data from either your experience or your program, that's important, but don't overwhelm them. The other thing is, make sure that you're telling them accurate. So let's say you're in a conversation and you're talking to a legislator and they're probably representing an area that you may live in or work in, and you might start talking about the basketball team at the high school or something, right? Oh yeah, I used to walk that park, that kind of thing, because you're trying to create that relationship. Well, they may ask you, hey, do you know how many people in my district have prediabetes? you don't have to take a guess, say, you know what, I don't know the exact answer to that. Let me get it and I'll get back to you. So that's a great relationship builder right there too. It's always better to tell them you don't know the answer to a specific stat than it is to give the answer and have it be wrong. Because if they like it and they like you, they might repeat it, and we don't want them to feel bad if they're repeating information that may not be completely accurate or get corrected later in public. So it's always best to say, I don't know, and get back to them. Next slide. And then don't forget to ask. So 1, 2, 3, right? The last thing is always the ask. So you always want to ask them to support it. So in the months leading up to the legislative session, we might have an ask of you to send a email to your legislator asking them to support this or provide just some information about this. And so one of the things in that will have an ask, and it might not be to support legislation at the time because we won't necessarily have a bill number then, but it will say, please support access in Utah for the National Diabetes Prevention Program. And then as we get closer, that ask will get more specific. But always remember, keep your story and your fact sharing informational, but brief enough so that when you have time to make your ask, and 2, it's not so much information that we lose our legislators in the process, especially during legislative session time. There are so many bills and so many issues that they're looking at. We want to be effective in a very short period of time or just a little bit of text. So keep that in mind about when you're writing your story or you're sharing your story in conversations. Hopefully this next year, you'll be able to have in-person meetings with your legislators if you're able to, if you want to come to the legislature, or when they're back home in their districts, if you want to have those meetings in person. But a lot of times those meetings are only like 5 to 10 minutes long, depending on what their schedule is. And sometimes those meetings might even be sort of walking to another thing. So sometimes I've been at the state legislature and a vote will get called and they're like, walk with me. And you've got to be prepared to have your story so sort of concise and effective that you need to be able to have it in a walking conversation down a hallway. Now, I don't want you to be discouraged if you ever set a meeting and it's a smaller timeline than that or anything, because they'll still remember you if you're polite. Always thank them for your time, and you share your personal story. Again, whether it's you as a person with diabetes or pre-diabetes who's gone through the program, a healthcare provider, or a lifestyle coach, a program manager, those kinds of things. Those things really do matter and will stick with them. So it's okay if it's a walking. Sometimes my best meetings have been walking with legislators and the most effective. So you just never know. So always be able to roll with it. And I think that is what, and then here's a few more tips. I've gone through some of them, but provide hope and a pathway for change. Use authentic, plain language. Make it sound like yourself. You don't have to be fancy. Use a lot of scientific terms. They're also just legislators, and while Representative Harrison is a physician, they all aren't. Some of them are, but they all aren't. Speak from your heart. Your heart really does matter, and if you're passionate about an issue, they will feel that passion. They will read that passion, and it will help educate them. Considering using a personal artifact. So what we mean by that is something like a photo in an email, or if you print something and like that. A lot of times for people with diabetes, we'll have them show what their meter looks like. I myself, have diabetes and I wear an insulin pump. So you kind of can't see that on screen because of the background, but I, might show my insulin pump. But there's nothing wrong with having a leave behind or something attached to an email that paints a picture visually. So you can always do that. And that works really well. If you're you have a family member who went through a program and they lost weight, before and after pictures are always fantastic. Or a picture of, like, for example, a plate of food that's a healthy plate of food, or groceries that they bought. Those kinds of visuals about change in a positive way can be really impactful. So think about that. It's also kind of fun to get creative that way. And just be yourself. And the most important thing I can tell you is it's a fun process. Legislators are very nice. They want to hear from you. That you're the experts, you're the people in their communities. And it's really important that you engage, because you really can make a difference. So to find your legislator, go to this website. It's you can also type in Utah legislature, state legislature, and you can find that. But here's the links. You can photocopy this with your phone, take a copy picture. We can send it out to you, and it'll put in your district, your address, and it'll pull up your legislators. And that's what it looks like. just another visual. See how visuals are good, but it's really easy to do. It'll tell you who all your current legislators are. And then you can also find who your congressional members are. But this issue, as we said, is a state issue right now for Medicaid. And so we'll want you to get to know your state legislators very well. And I really appreciate your guys' time. If there's any further questions anytime about this or where the status of the bill is during legislative session, you can always reach out to me. This is my email, my phone number, and it is an honor to get to represent Utah.
Thank you, Laura. And in the chat, there is that link that Laura mentioned to find your legislators, to put that in, put in your zip code and you can find them there. So you can find that link in the chat. Okay. Carrie Butler, one of the things I think some of you might be feeling maybe overwhelmed by all this information. So we will send out the slides after, and also the link to the recording if you're like so inclined you want to go back and listen again, because we'll have the recording, or if there's other people you want to share this meeting with so that they have the information as well. So if you're feeling overwhelmed, we'll have this send out to you. Another question some of you might be having is, what do you do if your employer doesn't allow you to lobby? Which I know many of you are in that situation as state or local health department employees or health center employees. And I think Carrie's going to touch on that a little bit to help maybe provide some clarification there. So Carrie. Morgan, you might have to make Carrie a co-host so she can unmute.
Great, give me just 1 second then.
Can you hear me? Okay.
We can.
Thank you. Okay, thanks. Hi. You never want to be unmuted without knowing you're going to be unmuted, right? That was really helpful that it showed me. Thanks for letting me be here, and I'm really learning a lot from these presentations. Thanks so much. I'm Carrie Butler. I have a consulting firm called Upstream. We work primarily on public health issues, and in this particular case, we're working with Utah Public Health Association to help inch this important piece of legislation along. And I've enjoyed working with Representative Harrison and Sarah on this last legislative session. So just to start out, I think it's really important to note that you are all the subject matter experts. So while Representative Harrison might be a medical doctor, we also have a layperson legislature, meaning that everybody is coming from a different background. We have lawyers, we have doctors, we have teachers, we have a trapeze artist. There's a lot of different personal interests in their own areas of expertise, and they depend upon you, the subject matter experts, to make good policies. So if you're working with a state agency, it can get a little challenging to know how you can and cannot engage with the legislators on issues such as this. So the number one recommendation I make is make sure that you ask your employer. They might have internal recommendations or guidelines that are different than the state lobby law. Most people, however, can lobby as citizen lobbyists. And there is a difference between lobbying and being a subject matter expert, right? And the difference is you can provide the information that you have to the legislators without asking them to vote one way or another, which is also extremely helpful, particularly on issues that somebody doesn't have background on. Or you can represent yourself as a citizen, as a constituent of a particular district, and present your information and then do the ask. But make sure that you check in with your employer, make sure that they know what you're doing to avoid any conflict. But you have the right as a citizen to lobby in that way as a citizen lobbyist, as long as you differentiate when you're doing the discussion with your legislator. So does anybody have any questions about that before I move forward? You good? Okay. Okay, so I wanted to just really briefly show you that the website, which I think is extremely useful and highly underutilized. We have a really great legislative website that is award-winning, incidentally. And we can go through there and find out exactly what happened in the legislative session last year, because a lot of work was done that we don't really need to replicate. Like Representative Harrison said, there was a lot of really positive feedback to this bill. And I'm going to show you how to tell what happened with it if you weren't involved in the committee hearings. Am I allowed to share a screen, Sarah? Oh, yep, I can. All right. Can you guys all see this, the legislative website?
Yes.
Okay. Okay, great. So this is the legislative website. If we're going to go to the bill. This is how I get to bills. It's a little lazy, or it's a little convoluted, but I'm just going to show you. We're going to the bills. We're going to go to the 2021 bills. What was the bill number again?
194.
194.
Okay, so we're going to come in here. We're going to pull up 194. There's a lot of ways to get to it. This is the way I do it if I happen to know the bill number. Okay, so 194. All right, so this will pull up the text of the bill down here so you can see what the actual bill did. But I'm going to show you here in the status bar. You can click on the status bar and you can come down here and you can see where it was heard, what committee it was heard. And so this was heard in the House Health and Human Services Committee. And you can see who voted and which way they voted by coming over here and clicking on this, the count, right? So we can see that everybody who voted on this bill voted in favor of the bill, and the only people who were abstaining were absent, right? Which is super helpful to note when we're going to this committee later and asking, or over the summer and asking them, or presenting information on the bill. You get to say, you heard something similar to this in the legislative set in your committee last year and you voted in favor of it. So you can tell how they voted here. And then you can see how they voted on the floor by looking at this larger number here. We had 4 no votes: Christiansen, Sigmiller, Snyder, and Strong. Everybody else was a yes up here except for the people who were absent. Again, I think this is super helpful when we're going to create our lobby lists to know who we need to talk to and who was maybe a sticking point. So that is that. Does anybody have any questions about how to see the status or how to identify how they voted? No? Okay, we're good. Okay, so now I'm gonna talk to you a little bit about what I think we ought to be doing during the summertime as we're getting ready for the legislative session. I think we had a really good presentation. I loved the presentations about Medicaid and what it is and how to talk about it. I think that was really, really helpful. And I think it's so important, again, that you're the subject matter experts and your voices are heard. And I think that it is so important that it's almost critical that we start engaging long before the legislative session. Representative Harrison can attest that it's like drinking from a water hose during that very brief 6-week period. And if you don't already have a relationship established with the legislator, by the time you get to legislative session, it's very difficult for them to remember you or focus on you or understand you or trust your area of expertise, right? So what I would recommend is that we all, if we're interested in participating in this sort of subject matter presentation, that we go to the specific committees that are going to hear this bill. Now, last legislative session, it was heard in Health and Human Services. So I assume that this legislative session will also be heard in Health and Human Services. And so those are the people we kind of want to focus on lobbying, because 140 legislators is a lot to get to, but 13 or 14 that are in that committee are a lot easier to handle. So in order to identify who is on that committee, you come here to the committee and you go to standing committee. That will list out all of the committees in existence. And if we're looking at the House Health and Human Services Committee, we can just click on here And over here on your right, you can see the list of legislators who in that committee hearing. And our legislative website makes it super easy to contact them. You just get to click on their name and it'll pull up their contact information. So most legislators are really good about checking their email, and most legislators have this phone number goes directly to them unless they've hired a staff, which they rarely do. So when you're calling them, it can be a little disconcerting at first. I always assumed that they would have some kind of answering service or something. So I remember the first time I picked up a phone and called a legislator, it was Senator Christensen, who retired last legislative or a couple legislative sessions ago. And he's he lives in a rural district. And I picked up the phone thinking I was going to get an answering service. And it was just a lady. And she was just like, hello. Like, hi, I'd like to speak with Senator Christensen, please. And she goes, hey, Ellen! And she was yelling for him in the backyard. And it was so comforting. Like, oh, I could do this. Like, this is normal. This feels normal to me. So don't be afraid to call the number. It's usually going to them. Representative Harrison is really nice. I like calling her. She's always polite on the phone. Okay, so that's how you identify what committees or who's on the committee and how to connect with them. And I think I'm going to create a list that goes out that has all of the names of the people that we're targeting and allows you to mark whether you've talked to them or not. Or when you talk to them, what their response was to this particular ask. And then the next thing I wanted to look at, because the bill passed with such favorable recommendation out of the Health and Human Services Committee in the House, and then it passed broadly on the floor. And the one kind of sticking point that we saw was in the funding mechanism, like who was going to pay for it. I think that it is really critical that we talk to the people who are on the social services appropriations during this lead up to the legislative session so that they know what they're talking about, so that it's on their radar as they're making their budget recommendations. And so they understand the importance and the cost saving benefits that we're hoping to see relative to states who haven't implemented and expanded this program through Medicaid. So in order to find those people, we're just going to come to the committees again. We're going to go to the Appropriations Committee, and this is going to go through Social Services Appropriations. So you're going to click on Social Services Appropriations Committee, and these are the legislators who are on that committee, and these are the people I think that we ought to be targeting first. So these are going to be on our list of legislators that we need to talk to. If any of them are your legislator, your specific legislators, awesome. Let us know so that we can send you or go with you to talk to them when the time comes. Do we have any questions about Appropriations Subcommittee? It's a lot. I know it's a lot. Oh, we're good. Okay. Okay, so that's that. Be ready. I will send out a Google Sheet that I'm developing so that you all can have access to it. If you're interested in doing this, if you are a little nervous to go up and actively talk to a legislator, call me. I will come. I'll hold your hand if that's something you want. Consent is important to me. I will not hold your hand if that's also something you want. That's also fine. But I'm happy to come with you and I'm happy to show you the ropes. It is the most fun thing that I do in my whole job. So, and I hope that it's fun for you too. I hope it's a good experience for you too. But thank you so much for the time.
Thank you, Carrie. So we just have a couple minutes left, just a minute or two. Are there any questions that people have that did not get answered? I saw there were questions coming in the chat. I think most of those got answered specific to some parts of the bill. Any questions about lobbying? I believe everyone has the ability to unmute themselves at this point, so feel free to just unmute if you've got a question. If you haven't, please click on the Google form and fill that out. That will help us see who is willing to set up meetings. Like Carrie mentioned and Laura mentioned, we're going to provide you with talking points. We'll provide you with lists and contact information. We're going to help you as much as we can to have the information you need, but we need you. We need you to be making some calls, doing some visits, reaching out to your specific legislators in your district. We can provide you with all the information and resources and help and handholding that you need, but we really do need you to help us to get the message across, to show that there are lots of individuals, lots of organizations who care about diabetes prevention, who care about Medicaid coverage. As Carrie mentioned, talk to your employer, see if there's any restrictions for you and how you can do that. And if you aren't able, think about people who have taken the class, or who you've worked with as a lifestyle coach, or friends or family members who have diabetes or who are Medicaid beneficiaries. So think about who you can reach out to in your life who might be able to help us as well. And please pass that information along. Representative Harrison, any final thoughts?
I just want to thank everybody. I think we have an amazing group, both participating and as panelists, and I feel confident that we're going to have great success this year. Thank you all so much.
Thank you. So we will send out the slides, we'll send out some materials, the recording. Those of you who filled out the survey will reach out to you individually. Thank you again to everyone who presented, just lots of really great information. Thanks for your time, and thanks for everyone for attending.